Hi class. So for today's lecture, we'll be continuing our discussion focusing in on theories of how we learn and moving on to how we remember as well. Now there will be two lectures in this week's series, so be sure to watch each one sequentially. Let's get started.
When we look at areas of the brain that are implicated in memory in particular, the first place we're going to look to is the cerebral cortex. And this kind of corrugated area of the brain that overlaps other more primitive areas of the brain below it. Short-term memory is stored here, and it is also the final storage place for visual, auditory, tactile, and verbal memories. The amygdala, right here, is involved in emotional aspects of memory. Emotional memories are hormonally enhanced and aid in the storage and consolidation of memory as well. Here in the cerebellum, also kind of thought of as a tiny brain in and of itself, non-declarative memories such as procedural memories or memories that involve conditioning, which we talked about in our learning lecture, are stored and encoded here. And we also have finally the hippocampus, this structure right here. It is responsible for whether memories will be encoded from short-term memory into long-term memory. So it kind of determines the significance of the memories themselves. So when we continue to discuss memory, the tip of the tongue phenomena is probably something that we have all experienced. And this is the phenomena of feeling that it's a feeling that you have when you know a word that you're searching for, but you cannot recall it. The word is said to be at the tip of your tongue. And the phenomena is one kind of what's known as metacognition. What is metacognition? Well, this is a type of thought process where we have knowledge, awareness, and control of our own cognitive process. So what does this mean? Well, essentially what this is referring to is that we have the knowledge and awareness that we know information, but we can't bring it into our conscious awareness. We know that it's stored in our long-term memory. Maybe there is some kind of encoding confusion, or cue confusion, I should say. Maybe the memory wasn't stored as effectively as it could be. So, for example, oftentimes with the tip of the tongue phenomena, in many instances, people know the meaning of a target word and how it may sound, but they can't seem to retrieve the word itself. So the tip of the tongue phenomena is related to consciousness, semantic memory, and language production. And one explanation for the phenomena can be explained by semantic memory. And semantic memory is our organized knowledge about the world, I should say. One approach to semantic memory, network models, holds that our semantic memory is a net-like organization of concepts in memory with many interconnections. So this approach explains that sometimes we only have a partial memory or what's known as a graceful degradation of memory that we have previously learned and stored with some efficiency. And for some information rather than a complete memory of information, this might explain the tip of the tongue phenomena, where you have kind of a partial remembering or a degraded memory because it hasn't been accessed. And remember, one of the things that we had talked about in an earlier lecture was that we have these neural connections that are solidified. Well, without reinforcement, those connections lie dormant. They become extinct, right? So when we talk about extinction in a conditioning response, it's not that the neural connection or the memory isn't there. It's that if the memory isn't used again and again, isn't accessed again and again, and that neural pathway isn't reinforced through repetitive accessing, it'll be more and more difficult for us to bring it into conscious awareness. And if it's never used, there is the chance that a process known as synaptic pruning, where the brain is constantly, kind of similar to a hard drive that you're defragging, is constantly trying to make its connections more efficient. So if memories aren't used, if memories aren't accessed, there is that chance that the neurons will be selectively destroyed. So those connections that exist within the brain will cease to exist based on the necessity and utility of that information being stored and being retained. But are memories always 110% accurate? Well, false or misleading information that one encounters, such as you talk to others or in an emotionally evocative situation where a crime has taken place, if you're questioned by police, say after eyewitness events, the nature and type of questioning, other people's experiences that are of an event that are recounted to, say, an eyewitness, are often incorporated into an account of that event. And because of the reconstructive nature of memory, we can, in fact, have inaccurate memories or even completely false memories be encoded. And so when we think about how forgetting takes place and how these false memories can be formed, we have to look at two types of interference that are primary. We have retroactive interference and proactive interference. In retroactive interference, information we have learned recently interferes with previously learned information. Conversely, proactive interference is where we have we have learned previous information, and that interferes with information we have learned recently. So when we think about how we can improve the accuracy of our memory and the efficiency of our memory, we have to logically go to studying. And there were some handouts for how to effectively study from last week. I really hope you guys utilize this. It could be very, very beneficial. And this is really what the research has shown, that when we study repeatedly, we aim for overlearning. And that doesn't mean relying on mindless rereading as a rehearsal technique. You have to do something elaborative. So remember when we talked about elaborative rehearsal. So making some kind of novel or interesting pairing of information to make it easier and have that network-like set of connections within your brain, make it easier to cue into what you're trying to access. So if you think of the brain as an interconnected network, where you have multiple cues to multiple things, the more you can relate different things to the topic that you're trying to remember, the easier it will be to recall it into your conscious awareness, because if one cue fails, you'll have several different fallback cues. So actively work with, think about, and be sure you understand the meaning of material. So if you don't understand the actual meaning of it, if you're just rehearsing a definition over and over again and trying to regurgitate that definition, odds are you won't be able to apply that information when you're asked to critically think about it on a test question, whether it's in this class or any other class. So really make sure you understand it, and if you don't understand it, feel free to ask questions to people who do, whether it's classmates or to your instructor. Also, organizing material is key. So outlines, lists of characters, parallel comparisons, diagrams, anything that can make the information more logical and can aid in the accessibility of that information. And also, try to think about how an instructor might try to ask a test question. So test yourself and study what mistakes you make, because oftentimes there are patterns to those mistakes. And if there are patterns, you can figure out where the weaknesses are and how to work around them. And avoid or limit interference, which means when studying, having the TV on in the background. For some people, that's helpful if there's white noise, or if it's seen as kind of a white noise, something that drowns out other distractions. But for many, it really is interference, and it really can be distracting. So if you find yourself with the TV on or music on, and stopping studying every couple minutes or every few minutes to tune into whatever's going on in the background. If you're in a crowded house living with roommates or parents and people are talking and you find yourself engaged in conversation again and again, then this could be something where it could actually really interfere with your ability to learn information. So find a quiet study space. If you're going to utilize music as a means of boosting concentration, try to choose music that doesn't have lyrics. And really try to have the sole focus be on what you're studying. And remember that context and personal state can be important memory cues, so state-dependent learning. So obviously this is an online course, but in in-person courses, oftentimes students find it useful to sit in the same place when they take a test as when they're listening to a lecture or participating in a discussion. If you guys go to the library to practice, to study, try to sit in the same spot again and again. These are all very beneficial. And again, test your recall, write down things from memory as well as recognition, and give yourself some multiple choice practice questions. These can all be helpful. Well, what about traumatic experiences and memories, right? We often have this two competing conceptions in psychology and also in pop culture, that something that is very traumatic is seared into our memories in a way that we just can't get it out, right? Because it was so powerful. We have the amygdala at play, and it is emotionally enhancing memories and searing it in. Well, and then we also have another conflicting view, or some would argue is a conflicting view, some wouldn't, where you have that if a traumatic memory is so painful and so emotionally evocative that we push it outside of our awareness, as Freud would say, we repress it, or if we consciously don't want to think about it, we suppress it. Well, in flashbulb memories, it really speaks to the first conception. These are distinctly vivid, precise, concrete, and long-lasting memories of personal circumstance surrounding a person's discovery or experience of shocking events. So people remember with almost perpetual clarity, or perceptual clarity, I should say, details of the context in which they first heard about news, such as what they were doing, with whom they were, and where they were. So whether this is big positive news like the Apollo moon landing, or whether this is traumatic and terrifying news, such as the nightmare that occurred on September 11th, these are oftentimes very vivid, vividly seared into our memories. And these flashbulb memories are not as accurate or permanent as photographic memories, but the flashbulb memory's forgetting curve is far less affected by time than is the case for other types of memories studied in basic memory research. So again, flashbulb memories are stored on occasion and retained for a lifetime. These memories are associated with important historical or autobiographical events, such as those including 9/11, assassinations of JFK, Martin Luther King, or the attack on Pearl Harbor. But one thing we alluded to a little bit earlier in today's lecture is the work of Elizabeth Loftus and false memories. So Dr. Loftus is at the center of a controversial and dramatic phenomena in psychology today. Often compared to the witchcraft trials, a recent rise in reported memories of childhood sexually repressed memories and accusations as a result have caused an uproar and questions of validity of those memories. So Loftus saw this child abuse explosion of the 80s and on as an open door for further memory research. And she's dedicated most of her life's work and energy to creating a vivid and brilliant model and theory showing that the memory is an amazingly inventive and also incredibly fragile process. And she has done innumerable studies of over 20,000 subjects showing that eyewitness testimonies are often unreliable and that false memories can be triggered in up to 25% of people by merely suggesting or giving incorrect post-event information. And the majority of Loftus's research focuses on repressed sexual abuse memories from childhood that suddenly reappear in adult women, often 20 years or more after the events took place. And her work raises enormous doubt about the validity of long-buried memories of trauma. Now, this is not to say that those traumatic reoccurrences of memory or re-experiences of memory are not accurate, just that some may be based on the fact that they are very much prone to outside influence. So she investigates the circumstances under which information is received, subsequent to an accident or a crime. And what she argues is that these may cause predictable changes in witnesses' recollection of events. So Loftus's criticism of repression has altered the cornerstones of psychoanalysis, Freud's view that you can bring about something that was once previously unconscious into conscious awareness, and raises a number of questions. The first one is, how common is it for memories of child abuse to be repressed? The second one is, how are jurors and judges likely reacting to these repressed memory claims? Are they buying into it completely? Are they doubting it completely, or somewhere in between? And when memories surface, what are they like? Are they choppy? Are they flashes of information? Or are they detailed narratives? And how authentic are these memories? Do they have bits of truth with long narratives that are fictitious, whether that's intentional or unintentional for the person or from the person? Or are they mostly true and maybe some of the details are left out from truth and are subject to outside influence? So what does this tend to look like? Well, Loftus does not deny that childhood sexual abuse occurs or that it might be possible for the mind to repress a trauma, but she questions the accuracy of those memories and the techniques used to resurface such memories. And this model mainly concerns a particular class of memories, those that emerge in adulthood after what's referred to as memory work. And memory work is a means of or process of retrieving the repressed memory through invasive therapeutic techniques such as regression, dream work, hypnosis, visualization, group therapy, and suggestions by a poorly trained therapist. In a case reviewed by Loftus and Ketchum in 1994, they give evidence of how a therapist's use of memory work and suggestions in the therapy played a role in a woman's development of a false sexual abuse memory that led her to later accuse her parents of abuse and neglect. After an extensive investigation, no evidence was found showing that any abuse had ever taken place. Therefore, the memories most likely, according to Loftus, never existed, but were created and truly believed by the victim. Now, that being said, others who argue against this say that for a memory such as that to occur, even if there are elements that are false based on sloppy therapy and suggestion from outside influences that are not part of the individual's experience, that there is very likely truth to the claims. They might not be exactly the same, but it's very difficult to manufacture a trauma, others would argue. So the answer probably lies somewhere in the middle. But where Loftus goes with this is not wrong. She encourages therapists to explore each individual case on credibility, motives, timing, and potential for suggestion in order to make a clear assessment of what mental product really means. So when the memory is being produced, make sure that it's very clearly being critically analyzed while also completely accepting the honesty of the client in their claims. Because even if the memory is false based on outside suggestion, the client is very much going to believe the truth and accuracy of their memory, even though assuredness is poorly correlated with accuracy when it comes to memory. She gives alternatives to therapy, such as the realization of positive aspects of a patient's life or the enhancement of functioning rather than the immediate uncovering of memories. But I encourage you guys to watch a video on this. And as you go through that video, I encourage you guys to ask yourself the following question. Do we believe that amnesia for a traumatic event is the result of a willful suppressing or an unconscious repressing? So a de-emphasis on painful trauma. Or do we believe that lack of memory of a painful event is simply a result of a diversion of attention during a traumatic event? So how do we conceptualize trauma and memory, and how do we understand false memories? And how much do we agree with Dr. Loftus? How much do we agree with alternative views that are more based in psychoanalysis? And how much do we agree that maybe the answer lies somewhere in the middle? So this will be your discussion question for this week. and I encourage you to look through the videos, move on to the next lectures, and move forward. I look forward to reading your thoughts, guys. Just for a little bit of review, we discussed towards the end of the last lecture operant conditioning. And operant conditioning, also called instrumental conditioning, is a method for modifying behavior, which is also known as an operant, if that helps you remember it, which utilizes contingencies between discriminative stimulus, an operant response, and a reinforcer to change the probability of a response occurring again in that situation. This is based on Skinner's three-term contingency, and it differs from the classical conditioning or Pavlovian conditioning method. An everyday illustration of an operant conditioning involves training your dog to shake on command. Using the operant operant conditioning techniques of shaping, you speak a command to shake, which is the discriminative stimulus, and then wait until your dog moves one of his forepaws a bit, which is the operant response. So following this behavior, you give your dog a tasty treat, which is a positive reinforcer. After demanding ever closer approximations to shaking your hand, and your dog will finally come to perform the desired response to the verbal command to shake. So you're shaping the behavior to approximate what you ultimately want and rewarding it along the way. And so Skinner is famous for the invention of the Skinner box, an experimental apparatus which he designed to modify animal behavior within an operant conditioning paradigm. And so when it comes to schedules of reinforcement, which we touched on in the last lecture, or the precise rules that are used to present or remove reinforcers or punishers following a specified operant behavior, these rules are defined in terms of the time and or number of responses required in order to present or remove a reinforcer or punisher. So different schedules of reinforcement produce distinctive effects on operant behavior. So we'll focus on two types of manipulation: response requirements and temporal requirements. When response requirements are manipulated, the procedures are known as ratio schedules. So the requirements of a certain type of response, for example. When time requirements are manipulated, the procedures are known as interval schedules because the timing of the response is primary. And so the relation of reinforcers to behavior in the natural environment is typically more complex than what occurs in a highly controlled laboratory procedure. And as mentioned previously in the course, the simpler procedures of learning processes are necessary to understand the ways in which individuals and animals alike learn in more complex ways. And so when we think about insight and learning, many problems we solve in our daily lives appear to require us to behave in new ways and learn in more complex ways from these basic processes that we've outlined so far. So what is different about the ways in which we learn in comparison to these very basic and somewhat animalistic processes? Well, Wolfgang Kohler was one of the founders of Gestalt psychology, along with Max Wertheimer and Kurt Koffka. He's also famous for his description of insight learning, which he tested on animals, particularly chimpanzees. Insight in learning theory is the immediate and clear learning or understanding that takes place without overt trial and error testing. So insight occurs in human learning when people recognize relationships or make novel associations between objects or actions that can help them to solve new problems. Much of scientific knowledge concerning insight derives from work on animal behavior that was conducted by Kohler. In one experiment, Kohler placed a banana outside the cage of a hungry chimpanzee named Sultan and gave the animal two sticks, each too short for pulling the food in, but joinable together to make a single stick of sufficient length to pull the food in. Sultan tried unsuccessfully to use each stick, and he even used one stick to push the other along to touch the banana. But later, after apparently having given up for a while, Sultan accidentally joined the two sticks together. He observed the result and immediately ran with the longer tool to retrieve the banana. When the experiment was repeated, Sultan joined the two sticks and solved the problem immediately. This result is somewhat ambiguous because it appeared that Sultan solved the problem by accident and not through insight, but a similar process would take place by thinking about material. So when we think about higher level and higher order thinking and higher level processing of information, we can think of insight as occurring based on understanding of the objects at play and also potentially mental imagery as well. So psychologists who study basic learning processes believe that they will help us to understand even the most complex behavior. How we learn, regardless of conditioning, is said to take place via core, very basic processes. The first one of which is that we're going to go over is acquisition. And this is the increase in the environmental guidance of a behavior as a result of either classical or operant conditioning. So when we think about repetitive reward or repetitive pairings, right, this is part of the acquisition phase because the environment or being exposed to these rewards or repetitive pairings are increasing the environmental guidance. They're increasing the understanding and the connection between these two previously arbitrary events. We also have habituation. This is the decrease in responding to a stimulus after that stimulus is repeatedly presented without an important consequence. So when you think of a child being punished for grabbing a cookie from the cookie jar, well, what do you think is going to happen if the child stops being punished? Well, they're going to go right back to the old behavior of stealing a cookie from the cookie jar, right? So the idea is that habituation is what happens when that environmental guidance ceases, and acquisition is what happens when the environmental guidance increases. So you can kind of group them together. An orienting response is necessary for the detection of a stimulus. For example, turning towards the source of a sound, such as the metronome or the bell in Pavlov's salivation experiment. So the orienting response here would be seen as something of a facilitator for any kind of conditioning to take place. And shaping, which we discussed briefly in an earlier slide, is the procedure in which successively closer approximations to a target behavior are reinforced. This is commonly used when acquiring a complex behavior. So think about shaping in terms of learning how to drive a car. Your first steps are not going to be to just tell the person to get behind the wheel and go. They're going to need to understand how the accelerator and brake pedal works. They're going to need to understand how to shift the car into drive and reverse and park, and also how to use the park brake, aside from understanding how to turn the wheel and how to apply pressure. Each one of those tasks goes into driving behavior. And so learning each one of those would be learning successive approximations towards the ultimate goal, which would be to be able to drive the car. Reinforcement is also necessary, and we've talked quite a bit about this in the last couple lectures. Reinforcement is the process by which an individual experiences changes in the environmental guidance of behavior. So when we think about the beginning of introducing that bell or that metronome, you're going to want to have some kind of reinforcement take place, usually immediately after a guided behavior. For example, in the case of Pavlov's dogs, we would want to be repetitively presenting the bell at around the same time as we're presenting food, right? This is rewarding this is rewarding the dog's salivation response and also pairing the two. In cases of reward versus punishment behavior, we would want either one to be taking place shortly after a either desired or not so desired action to be taking place, because without that temporal continuity, we're not going to be able to pair the two. A conditioned or secondary reinforcer is similar to what we've been discussing with regard to artificially shaping behavior. And this is where a stimulus can function as a reinforcer after it has been paired with another stimulus that can already function as a reinforcer. And also, Automatic conditioned reinforcement is a process in which a behavior inherently produces stimuli that functions as reinforcers for that same behavior. This is especially important in language acquisition, which we'll discuss a little bit later in the course. And still, there are even more different types of reinforcement. We have intermittent or partial reinforcement, and this is a procedure where not every occurrence of a behavior is followed by a reinforcer. This increases resistance to extinction, as we discussed in the last lecture, when a previously reinforced and learned behavior is no longer reinforced and begins to diminish. So if remember, both earlier in this class and the last class, this is what we discussed with regard to the effectiveness of variable reward situations such as slot machines. Why they're so effective in getting people to spend their money and keep playing is because every time somebody engages in pressing the button to feed in more money and go another round, what ends up happening is that you are hoping for the payout at the end. And so the fact that it's not guaranteed increases the likelihood that somebody is going to continue trying until they get a reward to justify repetitive attempts. So extinction, on the other hand, in its truest sense, does not completely eliminate the effects of prior reinforcement. So if reinforcers occur again after the behavior has undergone extinction, it rapidly recovers its previously lost strength, and this is referred to as spontaneous recovery. So think about it. If you learn a piece of information and you have repetitively paired stimulus and response, right? You continuously hear a bell and then get presented with food, so your response is going to be to salivate, in the case of Pavlov's dog, right? Well, if over time the bell keeps ringing and the food is no longer presented, eventually the dog will, to a certain extent, forget that pairing. And does that mean that the relationship has gone away? No, because it's happened in the course of that dog's life. It's a form of learning. There is an actual physical connection that takes place in brain tissue between neurons that solidify this learning. However, it's dormant in a sense. So when we think about something that is an extinct association, it's really something that's just kind of laying underneath the surface, waiting to be reactivated by the same reinforcer. So if the bell rings again and the dog then at that point is presented with food, then what's going to happen? The dog is going to begin to salivate, and for successive pairings of this taking place, or successive ringings of the bell, the dog will continue to salivate expecting the food, because it's not as if they need to be reconditioned into having this association. It's that the conditioning is already there. It's just kind of like flicking on a switch. It's been reactivated. And so this is referred to as spontaneous recovery. Now, these reinforced behaviors can also sometimes be generalized to other environments. And when this happens, an association is said to be referred to as stimulus generalization. This happens when multiple environments contain common elements that that a given organism recognizes. So a classic example I've used in the past in my psych classes for this has been post-traumatic stress disorder from individuals who were at war in the military. An unfortunate and common response to individuals who have been in the battlefield and are afflicted with PTSD is to have dramatic PTSD reactions, whether they be flashbacks or fearful responses based on the presentation of fireworks, for example, hearing similar loud popping and explosion noises that are associated with the initial trauma. And so this would be a really unfortunate but perfect example of stimulus generalization, where an individual may know that they're in a safe environment. However, the stimulus is similar enough in sound, smell, taste, sight, or the kind of auditory or any kind of exposure, I should say, that they are triggered into the same kind of traumatic response as if they were back in the battlefield. So this is stimulus generalization. The opposite is known as stimulus discrimination, and you actually can tell the two apart. And that's kind of the goal of PTSD treatment is to reduce the flashbacks, is to reduce those kinds of reactions. And both unconditioned reinforcers such as food and conditioned reinforcers such as stimuli paired with food activate a partially common reinforcing system within the brain. Food stimulates taste and smell receptors whose axons eventually activate neurons located in the nuclei and what's known as the ventral tegumental area of the midbrain, which you don't need to remember, just an FYI, where they release dopamine. And so what's important about that is that there are, what you do need to remember is that there are connections between the food kind of taste and smell receptors in the brain and the parts of the brain that release dopamine, which is associated with reward response and also a euphoric response, pleasurable responses. So dopamine is intimately involved in the cellular processes that change the strength of a given neuronal connection. So if you have connections in the brain between brain tissue, because of the widespread projections of dopamine releasing parts of the brain known as axons, dopamine can simultaneously affect the strength of a connection, or what's referred to as synaptic efficacies between many neurons. So what this is essentially saying is that the more emotionally evocative a stimulus is, or the more it's tied into survival, such as tasting something or smelling something, the more it is prone to being reinforced by chemicals in the body, like dopamine, for example, that produce a pleasurable response to engaging in a given activity. And that's not by accident. That is something that is built in for the purposes of survival. So the effect of both unconditioned and conditioned stimuli on dopamine-releasing neurons have been studied in monkeys, displaying increased neuron firing, or actual release of dopamine and release of neurotransmitters throughout the brain upon the presentation of an unconditioned stimulus. So we can see at a physiological level that there is a structural change in the brain and also a chemical change in the brain produced as a result of conditioning behaviors. So neurons affect one another through the release of brain's chemical known as neurotransmitters. And so this is what is essentially taking chemical messengers and this is what is essentially taking, I should say, almost electrical impulses throughout the brain and converting them into chemical messengers to continue communication between cells in the brain to tell us how to react, how to respond, and how to learn. So the primary excitatory neurotransmitter, the main kind that's at play in the brain, is known as glutamate. And if the neural pathways have recently been activated or followed by a reinforcer, dopamine-related neurons in the midbrain are stimulated, and resulting new proteins that are generated produce long-lasting structural changes in the brain, increasing the chance of initiating a synaptic potential in this pathway again. So what we're really saying is that the brain is actually producing new tissue. There's actually more of your brain there when you learn something than there was before, because there's actually the growing of new pathways throughout the brain that creates a solidified response. So it's almost like increasing the holding capacity of your brain because you're learning a new behavior, right? And so finally, for this section of the lecture, you may find it interesting that learning and memory make up two different chapters in many textbooks, including, I believe, the textbooks that we use for this course. And though these two terms seem very much related, they're often divided up. In fact, learning and memory and cognition are also usually taught as two separate classes and represent two fairly distinct disciplines within psychology as a whole. And one way to understand the distinction between the two is to consider B.F. Skinner's often quoted definition of learning. Quote, a relatively permanent change in behavior as a result of experience, unquote. So one basic difference between memory and learning is that memory is not necessarily relatively permanent. In fact, sensory memory, by definition, lasts for a few seconds at most. So, second, note that the term behavior is an important part of Skinner's definition, with the clear implication that learning is something that is empirical, which can be observed. On the other hand, most cognitive psychologists consider memory to be an abstract construct, which can only be studied indirectly through empirical measures. It's also helpful to consider the historical roots of these two subdisciplines. Learning grew from the behaviorist school that we touched on in our first lecture, while the area of memory and cognition was the direct result of the cognitive school of thought. As a result, these two areas share many of the characteristics of the historical behaviorist and cognitivist movements. As mentioned, those who study learning are more concerned with observable measures as opposed to unobservable constructs. Further, research in learning often involves non-human animals as subjects, while cognitive and memory research usually involves humans or computer simulations. With these distinctions in mind, let's turn our attention to the study of memory. So, what are some of the core characteristics of memory? Well, that firstly, it's not a fixed permanent record. It's subject to change. It's something that we can actually modify. So just because you remember something some way doesn't mean that it's not prone to errors in remembering. It's also reconstructed in pieces during recall. And because of that, it depends on our attention, our expectations, our past experiences, and how we're questioned. And since memory is malleable, we always need to question its accuracy. And accuracy of memory is only weakly correlated with confidence. So we can't really say that despite the fact that we are very confident in something occurring, that it's actually something that occurred exactly the way that we remember it. Now, we can be very confident in something and still be very wrong. A good example of this is something that I've often shared in my in-person psychology classes, where I was making a long drive down Interstate 5 from the Bay Area to Los Angeles. And I was driving along probably at about 60, 65 miles an hour. There was a fair amount of traffic, and so the cars were packed reasonably tightly together. And somebody passed on the shoulder and cut off the car in front of me, and happened in a split second, and the car in front of me didn't have enough time to react and slammed into the car that cut it off. So everybody pulled over, and including myself, to make sure that the person that was hit was okay, and the person that was the person who was cut off was also okay. And the first person that I went to was the car in front of me, and that driver said, oh, the person who was driving that cut me off was on their cell phone. And I'm positive I saw it with my own eyes, and I, in the heat of the moment, adrenaline was pumping, and I thought that I had seen that too when I was later questioned by the police that were taking a statement, taking a report. And then knowing this bit of information, I had to stop and think about whether the driver was actually on their cell phone. Now, they may have been, but one thing that I know is that everything happened so fast that I didn't see it. I didn't even see what the person who was driving looked like. I just saw the car cut off the other, and then the accident happened. And so this is a good example of how the influence of somebody else saying something to us can shape our perceptions of what we recall, because when I thought back in that split second, I pictured an individual holding up a cell phone. But did I see that? That's something that, in retrospect, I didn't. And for that moment, I was very confident in what I saw because of how emotionally evocative the situation was. So, As stated earlier in the lecture, learning and memory are essentially part of the same process. And they're divided up predominantly by the academic traditions within psychology that have contributed to the most research on the two subjects. Now, we can understand learning and memory as existing within the broader context of adaptation to one's environment, right? How do we respond to the environment with which we live in, right? How can we survive in that environment? Learning reflects the brain's plasticity, or ability to adapt to new circumstances. So when we say that something is adaptable, something is changeable, we're saying that it's plastic. So memory is the cognitive process of encoding, storing, and retrieving information. Okay, so how do we pull these apart? What are the definitions? Well, encoding is the active process of putting stimulus information into a form that can be used by our memory system, right? So it's kind of like when you plug something into the wall and you charge up your cell phone, right? What is the point of a charger? Why can't it just be a cord that goes directly into, say, your iPhone? Well, when you have electrical energy that's in the wall, you have an alternating current. And when you plug the charger into the wall, it's converting that current into a direct current, so it can be received by your cell phone, so you can actually charge up the batteries. Encoding is kind of like that. It's taking the information that's out in the environment and it's putting it into a usable and understandable context for us to be able to remember it. Then there's consolidation. This is the process of intrinsic rehearsal between encoding and storing. So it's kind of like what you might do when you're studying for an exam, right? Going over and over information again and again in a way that it can be retrieved, in a way that it can stick, right? And so our mind automatically does this on an unconscious level. And then finally, we have what we think of when we think about remembering. We think about storage. It's the process of holding and maintaining the information in memory, it essentially sticking in our thought. And finally, retrieval, which is the active process of locating and using the encoded, consolidated, and stored information in our memory, either to critically think or to just kind of rote memorize or remember, I should say. So one of the first things to note about memory is that you are aware of each of these processes in somewhat different ways. We're sensitive to the experiences we have and which we remember, the locations where memories take place, and what emotions we're experiencing when we remember, because that's all part of the process of triggering the necessity to store information. So sensory input then wouldn't be sufficient. We would need to attend to and process that sensory input to get it into memory. So it's not just as simple as sitting in a lecture. If you're sitting in front of this screen, listening to me talk and looking at the slides, if you're not paying attention, odds are you're not going to remember anything for when it comes time to the test, to get to the test. So some encoding occurs automatically and effortlessly, especially if it is based on personal experiences or information that we're really interested in, right? So maybe you just absolutely love psychology, and this is what you want to do as your major. This is what you want to do as far as a career is concerned. You want to utilize psychology in one form or another. For you, it might be effortless and automatic that you remember most of the things that I say in this course. But for others who might be taking this as a transfer requirement, or because they're simply not sure whether they're interested in psychology just yet, it might take a little bit more effort. Also, some types of basic learning, such as conditioning and motor learning, because they're so important for survival in our evolutionary history, these tend to occur effortlessly and automatically. But much of encoding is effortful, and it requires special thought and special practice. So when we think about memory, we can't just say that there's one simple type of memory and that's it. Sensory memory, which is very brief lasting of the sensory image in our sensory, what's known as our sensory register, is kind of that initial sense. It's not dissimilar to um, smelling a smell of, say, incense or flowers, and then remembering for a brief period of time exactly what that smells like, almost as if you are experiencing that smell, even though you're no longer exposed to what you're smelling, say the incense or the flowers, right? But this lasts a very brief period of time, just enough for it to be consolidated, encoded, and stored. We also have iconic memory, and it's a form of visual sensory memory that briefly holds the visual representation of a scene that has just been perceived. But that's visual. Well, as you might expect, there's also another form of sensory memory that refers to auditory sensory memory, and this is known as echoic memory. So think of an echo. And this is a form of auditory sensory memory for sounds that have just been perceived. Now, when we remember, we can also divide it into memories that don't last very long and memories that are theoretically limitless and lifelong. And so this is the distinction between short-term memory or working memory, which holds information we're actively thinking about, and long-term memory, which are items encoded into long-term memory that are held almost permanently. And so the short-term form of memory, this working memory, holds a limited capacity of information, usually about 7 items, and a duration of less than a minute unless we're actively rehearsing to consolidate the information and to encode the information into our long-term memory. So the point of short-term memory is kind of like a middle-of-the-ground holding tank for what's going to get filtered into long-term memory and what's going to be forgotten. So usually it's the stuff that is rehearsed. It's the stuff that is encoded and is seen as valuable that is stored long-term. And when we think about the limited capacity of short-term memory, think about how many things are 7 items in capacity. A phone number is a perfect example of this. It tends to be 7 items because that is the limit of what we can remember. So we usually use maintenance rehearsal, or repeating things over and over again, to hold information in short-term memory. And disrupting rehearsal will undoubtedly interfere with short-term memory. Maintenance rehearsal is basically what it sounds like when we're repeating things over and over. It's maintaining information in short-term memory by rehearsing it in your mind. And this allows the duration we hold short-term memory to increase about 10 seconds, from roughly 20 to 30 seconds of holding time. Maintenance rehearsal is not terribly effective for encoding long-term memories, however. But elaborative rehearsal is, and this is organizing, thinking about, and linking new material to existing memories. This tends to be more effective. So the more associations we build, the stranger we make things to make them more memorable, the more cues we'll have for retrieval later on. So, in a sense, the more deeply you process information, the better you tend to recall it. And I've posted a couple handouts from Dartmouth College that go over some of the things that interfere with our learning and some study strategies to actively study to improve outcomes in recalling information. I strongly suggest you guys look at that. There may be some overlap to that between what we're talking about here, what's in the textbook, and what's in those handouts. To that extent, it will be covered on the exam. That being said, that they're posted much more for your benefit in the course. I strongly recommend that you take a look at those. So, when we think of long-term memory, it can be even further divided up. And so we have episodic memories. And so these tend to be based on life experiences. And these are contrasted by semantic memory. So when we think about semantics, we think about language. Well, that's because we're talking about information and knowledge. And so both episodic and semantic memories are often called declarative memories. And that's because we can recall, we can talk about them, so we can declare the memories, we can discuss them, we can bring them into our conscious awareness. Now, procedural memories, so how to do things, and memories established through conditioning, these are thought of as being non-declarative because we can't really consciously recollect and talk about the changes that went on in our body, right? It's difficult to actively talk about the process of conditioning because it may occur at an unconscious level. And even if we do remember it consciously, we might not remember the sequence as it occurred. It's occurring on something that's very rudimentary, on a very rudimentary level. So, why do we forget? Well, this kind of speaks to some of the handouts that we have assigned for this week. The first one would be encoding failure. We might not have paid attention, whether that was conscious or due to something like an attention deficit hyperactivity disorder. We just couldn't stay focused for one reason or another. It could also be due to anxiety. Oftentimes, being really anxious about the outcome of, say, a test or a term paper can really prevent us from actually storing information, because while some people perform well under pressure if they believe in their ability to do well, those who might be a little bit shaky in that belief, anxiety is actually a huge hindrance. We also have insufficient cues to retrieve stored memories. So maybe the way that we tried to study didn't give us enough ways to cue into something that we had to remember. So if you guys might remember from grade school, trying to recall state capitals, for example. Another example of this would be the tip of the tongue phenomena. What does this refer to? Well, the tip of the tongue phenomena in particular refers to an individual's sense that they know information, but they can't label it, they can't talk about it. Think about seeing a celebrity on TV and knowing who they are, but forgetting their name, and it's right on the tip of your tongue. Well, this is likely because there just weren't enough cues to retrieve the stored memory. It's in there, but actually fully accessing it would have required maybe more of an elaborative rehearsal. There can also be cue confusion or interference. Cues for different memories may be too similar, so wrong memories get retrieved, right? So trying to recall a song that you may have heard a lot many, many years ago, and then confusing the artist, right? So was that a song from the Backstreet Boys or was that a song from NSYNC? Well, they're kind of similar in some ways, although don't chew my head off for saying that if we have any NSYNC or Backstreet Boys fans here. But the idea here is they're both boy bands, they had a similar genre, they were out around the same time, so that would represent cue confusion, it would represent interference. So we might not remember who did what song. And so we can have different types of interference. We can have proactive interference, where older memories interfere with newer memory recall. And we can also have retroactive interference, where newer memories interfere with older memory recall. And also, finally, because context cues change, state-dependent memory, or your surroundings, your mood, your physical state during learning, can all be cues to aid recall. But if the context changes, it might be difficult to actually access those memories. A good example is sometimes instructors will actually encourage their students to sit in the same seats every week in class, especially when they're taking the test, because the idea is that you've learned in a very specific context. You're sitting next to the same people, you're sitting in the same space, you're at the desk that you're used to sitting at, and that theoretically would increase the likelihood that on test day you're going to remember the information that was learned in that context, in that space. And so recall is best when the context, mood, and physical state are the same as when the memory was originally formed. And so cases of severe memory loss support the proposal that we have different types of memory, such as short-term and long-term, declarative versus non-declarative, etc. So severe memory loss, as we know, is commonly referred to as amnesia. And there are several different types. The first one is retrograde amnesia. And so this often occurs as a result of head trauma or other temporary disruptions of normal brain functioning that interrupts the storage of memories of events just before the trauma. So when we think retro, we think before. This is retrograde amnesia. We also have anterograde amnesia. So this is damage to the memory systems that impairs the ability to store new memories after the damage takes place. And sometimes these can occur at the same time. We can have both retro and anterograde amnesia. But also, some of you may have heard of repressing or suppressing something. In this case, it would be repressing valuable information on something that was very difficult to go through, like a trauma, right? And so this would be referred to as dissociative or psychogenic amnesia, which is where someone experiences such a painful event that they, in order to be able to defend against it, in order to be able to handle it, they need to push it outside of their awareness. And so it's there, but it's underneath the surface and not consciously accessible. And so here's a little graph just to show the difference between retrograde and anterograde amnesia. So the brain damage would be occurring at this point, and then with retrograde, the events prior to the brain damage are not remembered. With anterograde, the events that occurred after that event are not the ones not able to recall. So the single most famous case study in the history of neuropsychology is that of an anonymous memory-impaired man, usually referred to only by the initials HM. Now he's not so anonymous because he's been studied again and again and again throughout history. And this patient has been one of the most severe cases of amnesia ever observed. He had been followed for over 40 years by more than 100 researchers and is the subject of dozens of research papers and book chapters, not counting the ones that are submitted to colleges for Psych 1 classes and Psych classes throughout undergraduate and graduate education. The early studies of HM provide a basis for modern neuropsychology, and the findings of those who have studied him are today a cornerstone in memory research. HM, sometimes referred to as Henry M., was born in Hartford, Connecticut in 1926, and his amnesia was the result of neurosurgery performed on him in an effort to alleviate the symptoms of his epilepsy. The origins of HM's epilepsy are unclear, but his condition is sometimes attributed to a bicycle accident he had at the age of 9. He sustained a head injury when he was knocked down by someone on a bicycle and subsequently lost consciousness for about 5 minutes. Soon afterwards, he began suffering from minor epileptic seizures and had his first major seizure on his 16th birthday. However, HM also had a family history of epilepsy. 3 of his first cousins from his father's side of the family also had the condition. And so what this could mean is that there was something known as a gene by environment interaction taking place. This is something to write down. Gene by environment interaction. What this essentially says is we have a genetic predisposition for something. It's more likely something's going to occur because it runs in our family. But just because it's more likely doesn't mean that it's going to occur absolutely. An individual who was never hit by a bicycle and knocked on the head and knocked unconscious might not have, with the same genetic predisposition, developed epilepsy. In this case, that might be the cause, the combination of genetic and environmental factors. But regardless of the etiology of his epilepsy, when HM reached his 20s, the frequency and severity of his seizures grew progressively worse, and by the early 1950s, he was having up to 10 seizures and blackouts a week. So the seizures became incapacitating, and as a result, HM was unable to continue work as what was known as a motor winder, so kind of a blue-collar job, but that required attention, concentration, and skill. And HM's condition was intractable. He proved to be completely unresponsive to the various anticonvulsant drugs he was prescribed, even when given the maximum dosage. And in 1953, at the age of 27, he was referred to William Beecher Scoville, the founder and director of the Department of Neurosurgery at Hartford Hospital. At the time, Scoville was experimenting with a surgery as a means of treating psychosis. He localized HM seizures to the temporal lobe of the brain, so one particular part of the brain, and on September 1st of that year performed on him an experimental surgical procedure called a bilateral medial temporal lobe resection. So, very complicated phrasing for the removal of large portions of the temporal lobe from both sides of the brain, both hemispheres of the brain. HM's condition justified drastic measures, and the surgery he underwent was extensive and radical. Tissue was removed from the anterior or front tips of the temporal lobes and the medial or inner surface of the brain, extending 8 centimeters backwards. They removed actually a significant portion of his temporal lobes. And the resection therefore completely removed his amygdala, which is and the ethereal and peripheral cortices, about two-thirds of the hippocampus, what was known later as the limbic system, an area responsible for emotionally encoding memories. The surgery was successful in alleviating the symptoms of HM's epilepsy. Afterwards, he had about 2 seizures a year, but it had been performed as a last resort, and it had devastating consequences. HM had been left with profound anterograde amnesia and partial retrograde amnesia. But he did have the ability to learn new motor skills. So he had the ability to develop procedural memory, because there's that conditioning-based memory again that's so important for survival. So that led researchers to believe that these are probably handled by another part of the brain. And so I would encourage you guys to watch the documentary on the case of HM. It's not very long, but it's an important view in understanding his case and understanding memory. And we'll continue on to our discussion of memory in the brain next week, and hopefully move on to the next topic.